Dr. Sriharsha for that nice introduction. Uh, as I think everybody in the group who has joined this today's session is aware that this is going to be a series of webinars which we are going to take step by step, and we are beginning now with the importance of medical research, right? So the first session is on importance of medical research, and after I speak on the importance of medical research, Dr. Animesh will be taking you through a research question and the steps in formulating a research question. So I begin with the famous quote by Hudson Maxim, who said that all progress is born of inquiry. Doubt is often better than overconfidence, for it leads to inquiry, and inquiry leads to invention. Now let us go into what is research. The dictionary defines research as a careful investigation or inquiry, especially through searching for new facts in any branch of knowledge. So, why is research necessary? It is necessary to generate new knowledge and also to generate or to discover more technology that can help us solve or deal with an unsolved problem. Now, what is research? Research is the systematic collection, analysis, and interpretation of data to answer a certain question or to solve a problem. It is an endeavor to discover new facts, procedures, methods, and techniques by the scientific study of a course of critical investigation. So, the first thing that one needs to do is to identify a problem or a set of problems and prioritize those problems, and then conduct research by collecting data systematically, analyze those data, interpret them, and find a solution or find a find a solution to deal with that particular problem. So why do we need to research? One, research helps us to identify a problem or a set of problems, and also to prioritize the problems. That is, today, if we look at the today's world, every researcher is probably trying to put COVID-19 on priority and find some solution to that particular problem. Then today's need is probably COVID-19. Then what does research do? It helps us design and evaluate policies and programs which will better healthcare towards the particular problem that has been identified with the available sources. Now, what does research do? Research is conducted to satisfy one's curiosity. So in our field, if we look at how the study of the larynx began, it was curiosity. So it was Manuel Garcia, who many years ago, he was actually a musician, and he had gone to perform at New York with his father and sisters. He was performing Mozart, and during the rehearsals, he developed a strained voice, and the voice became so strained that he could not continue with his singing career. And what he did was, he just wanted to find out what was going wrong with his voice. So he used a dental mirror and he reflected a ray of light from the sun to examine his vocal cords. And that is where he was stunned by saying that it is the opening and the closure of the glottis that is responsible for the voice production. Subsequently, he started training people in music, and one of his students, a Swedish, she developed voice strain. She was a soprano swinger. And when she developed voice strain, she approached Garcia with the problem. And he said that you take voice rest for 6 weeks and you will be all right. And that is how his curiosity and his ability to understand the problem enabled him in finding a solution. So for voice strain, he said voice rest would be the best solution. Subsequently, there were others who tried to visualize the larynx using this technique, and then direct visualization of the larynx came into practice. It was Alfred Kirsten who came with the direct visualization of the larynx, and that sowed the seeds for laryngeal surgery. Now, subsequently, it was Klein-Sasser who started using the microscope, and we all know how microlaryngeal surgery began. So what happened when one begins to inquire out of curiosity? It adds to the scientific knowledge, which we already have, and then we begin to study new phenomenon and establish facts. Then we start solving problems, and that helps us further in improving medical practices and care. If you look at the discovery of the smallpox vaccine, Edward Jenner observed that milkmaids who were previously inoculated by the cowpox virus did not develop smallpox. And then this led through the discovery of the smallpox vaccine. And then this changed policy wherein vaccination for smallpox was started, and we eradicated the disease completely. Now, what is the purpose of research? Everybody today is trying to stay alive. All of us want to live longer. So how do we live longer? By developing practices which enable us to live longer. So research helps us to prevent, cure, or treat disease and related human conditions. And research helps us to improve the lives of our patients. Now, what does research aid? Research helps us by giving us information about various quality indicators, health statistics, mortality, and morbidity. Now, this forms the basis for national and local planning. So, public health policies develop based on the various quality indicators that we have. Now, research gives us valuable information that helps us develop evidence-based practices which form the heart of medicine. It also helps us develop newer diagnostic tools and drugs for treatment of various diseases. Then we develop various therapeutic protocols and try these protocols and evaluate whether these are effective. And then when we evaluate if these are effective, we start developing programs to counter the problem at hand. So when research has a great value on society because it provides important information about disease trends, their risk factors, outcomes of treatment, the public health interventions that take place for a particular disease, and also helps us to understand the various patterns of care and also the healthcare costs and use. So when we try various therapies and we try to develop a cost-effective therapy, it contributes to affordable healthcare, and thereby it helps reduce the burden on the economy. Research is also crucial for comparing and improving the use of drugs, vaccines, various medical devices, and diagnostics. If there was no research happening, we would have today been crippled by so many diseases. In summary, research helps in community diagnosis, it helps in the control of epidemics, it helps in prevention and control of various diseases, evaluation of curative and preventive measures, and helps in the study of natural history of various diseases, and also planning and implementation of health services. Now, development of new drugs and new ways to treat old and new diseases can happen only when we do research. Now, what are the criteria for a good research? Good research involves clear statement of a problem or the purpose of the research. We need to have an explicit plan or a proposal for the conduct of the research. There has to be a clear and a detailed research design. The researcher needs to be honest, transparent, and committed, and he should report all observations without distortion. Research should also be objective and it should be logical. It also requires deep knowledge of the subject. One should conduct research by collecting the data properly and analyzing them in a thorough and scientific manner. All through research can happen only when one has patience and is not in a hurry to complete the activity. Research needs to be systematic, logical, empirical, and replicable. Now, what are the steps of conducting a research? First is identifying a problem or a need or a priority problem. And then the next step involves developing a research question. Based on the research question, one has to go for a literature review and then formulate research objectives. Based on these research objectives, one has to design the research and the various methodologies that are involved in the research, get ethical clearance for the conduct of the research, and then conduct the research and analyze the data, then summarize the findings, and then publish the data, thereby sharing the details with the rest of the scientific community. So with this, I hand over the baton to Dr. Animesh Jain, who will be talking to you on prioritization of a research problem and formulating a research question. Thank you very much.
Thank you, Dr. Vijaylakshmi. Let me just start sharing my screen. I think
I have to stop my screen share. Just a minute.
Yeah. Shall I?
Yes, sir, you can start.
Yes, okay. Yes, you can start.
Okay, thank you. Hello and good evening and greetings wherever you are. I believe there are people from elsewhere as well. So am I audible and the slides are visible? Yes?
Yes, sir, you can go ahead.
Okay, right. So we will start with the next part of the session today. As Dr. Vijaylakshmi has already put forth the importance of research, and she's given you some brief idea and set the whole session for today. So let me proceed. As we all know, and as of today, as we talk, we all know that importance of epidemiology is being realized by many people, okay, including all the clinicians. I'm not trying to get into a debate, but then definitely this is very important that we all have some idea and basic idea about epidemiology. So it is very important from various points of views. One is prevention of diseases. Now, again, if we want to have an approach which is for entire population, or is it only focused to high risk population, we can have that. It can be also sometimes, see, we say in clinical medicine, and medicine as a broad terminology I'm using, I say that this is a pathognomonic of something. If I see this feature, I say this is pathognomonic. Like for apical systolic murmur, I say, oh, this is mitral regurgitation. So how did I get to that? This is again based on research. So this is like all these things are important. And then again, if I come up with a modality of treatment, which is newer, or maybe I come up with some kind of a surgical interventions which has something different from what is already existing. How do I say that this is better than the other? So again, I need to do a research, a proper epidemiological study to prove that. Or many a times we are questioned. We are questioned by patients party or even patients. They say, doctor, how long do I have? Or how long does my, so-and-so near and dear ones have? So this is something like, survival analysis, and we are questioned about survival because of especially some diseases like, carcinoma. And then we need to answer that. How do we know what is the 5-year survival rate? What is, the prognosis? So that's something, again, we get from research, epidemiological research. So what are the steps in research? Now let's quickly look at this. Vijay has already talked about this. So identify the question or a problem, conduct a literature review of the question. Now, many a times you might say that, there may not be available literature. Of course, that is a possibility because you cannot, otherwise start something new. So there is a possibility, but whatever is available in that area or in the area, in the context of the background, that you should review, and then frame a hypothesis, spell out implications. Then go on to develop the study design, list all the methods, the tools for data collection, any kind of measurements, approvals required, all that. And this is nothing but the whole thing which is known as a protocol. So that is the crux of the whole thing, that is protocol. And this forms the protocol. So when you detail out your plan, that's your protocol. And then once you've done this, you've gone through the scientific committees, you've gone through the institutional ethics committee, and then you've got the approvals and you've got everything in place. You start doing it and complete the research. You gather data and analyze the data. Once you analyze the data, you interpret them, the results, and then generate conclusions, and then write your report. Now, depending on which stage you are, if it happens to be a resident or a postgraduate, then obviously it will have to be a form of thesis. If say doctoral student, then it will be a PhD thesis. If it's for a consultant, maybe they are doing it for a project, or maybe it's for just answering certain questions and then leading to a conference presentation or a publication. So depending on wherever you are, it will be. So we don't stop at that. It's always that once you are done with the research we conduct and you come out with the results and you write a report, you always present and then you publish it. So that's something which is very important. Now let's quickly look at the objectives of this session. So at the end of today's session, we aim that the participants shall be able to appraise the importance of learning research methodology, and that's colored blue because that was already covered in the segment just before me. Describe the features of good research question, formulate a research question, list the components of a research protocol, and describe the steps involved in developing a research protocol, and however much we would like you to, but within this comparison of a new vaccine with an existing one, or maybe a surgical method with another newer technique, or a variation on technique, or something like role of yoga in asthma management. Now this is all part of something broadly known as biomedical sciences, which encompasses all biological, medical, and clinical research and biomedical product development and evaluation. Now, why are we supposed to know all this? You must be wondering. Now, this is because many a times when there is a call for grants, or there are some premier agencies putting out, we want proposals in this area. Many a times we are wondering what exactly are they looking for. Just to have an idea, you need not know everything by heart, and of course you will have recording shared, so you will have the reference material, but just to have an idea. Similarly, sometimes we want to quantify the problem, and being from community medicine and public health background, so prevalence of TB in a population or a geographical area, or sometimes there's a particular behavior observed among a particular group of people, like aggressive behavior among prisoners, or sometimes it could be you see suicide attempts among high school students. Every now and then we see newspaper reports. Now this is something which we are doing among the population, and we are linking it with demography and their socio-behavioral aspects. So this becomes population sciences research. And many a times we are intrigued. There is a program ongoing. Why it's not helping? Something like ICDS. There is a program which has by means of Anganwadis, it's supposed to lead to decrease in malnutrition by giving supplementary nutrition and other things to children. Now, why is this ICDS, after being there for almost more than 3 decades, why is it not helping? So that could be your question. Or sometimes you will say, let me see what is the cost effectiveness of one treatment versus another in a particular disease. Or you want to see what is the health seeking behavior. We have put up facilities, we have got all the things. What is the health seeking behavior? What is the cost that they have to incur? Is there an out of pocket expenditure? So that kind of thing, and all this kind of research comes under the umbrella of health policy sciences, which includes health policy research, health systems research, and health services research. Now, all these are very important because many a times there will be like proposals called for this area, because these help in policy making. These also help us in giving guidelines to maybe say streamline the ongoing program, or maybe modify it to make it better. So let's come to the main topic, that is the research question, and after this we'll move on to writing a protocol. And we will have about 15-minute segment in the end to answer your questions and take some questions as well. So please stay tuned. Now, where do research ideas come from? Any participants would like to share in the chat box? Anybody wants to tell us, where can we get ideas from? Because many a times I'm asked this question, that where do I get, I don't get ideas, I know that I can do research, I have potential, but I don't know where to find ideas from. Yes? So can you type in the chat box, please?
Okay, literature search, reading journals, voids in research, articles, problem, experience, clinical practice, survey. Very nice. Brainstorming, extremely good. Magazines, okay, that's what's happening in the world around. Personal experience, yes, our situations in day-to-day practices. Clinic, very good. Identifying the practical situations from mistake. Yes, all of these. And so, Animesh, take over.
Excellent.
Again.
I think excellent. I must compliment the participants. You listed out quite a few. Let me show you what I had in mind. And of course, you have covered almost most of them. So obviously, many a times you say that, we can search the medical literature. So yes, searching the medical literature. When we go for conferences, sometimes we get ideas, or sometimes there are presentations and we say, oh, but this could have been done. Probably this was not addressed. So we get an idea. Or colleagues or mentors in same field or different fields, not just for postgraduates or residents, but also for people who are, say mid-level and, junior level. They find that colleagues or mentors will give some ideas. And why I said same or different fields, because many a times, if I'm, say, for example, from community medicine, and I'm talking with a person from radiology, and he'll come up with a problem, and I say, I think I'm seeing this. Can we do something about it? Or if there is a person from, say, orthopedics, and he is talking to a person from anatomy, and he's talking, sometimes even we've had this collaborative effort where there is somebody talking to a person in engineering background from, say, NIT Surathkal, and they say that, oh, there is biomedical kind of thing which can be done, and then they collaborate. So orthopedician with an engineering background, and that's again possible. Sometimes you find that certain research organizations, funding organizations, will they have their own interests, so they will have calls put up. So you find, and the interest matches, so that could be. Sometimes you would have done a previous research. It could be a small research, but you've done some research, you want to expand it. So new ideas out of previous research. It could be a thesis during PG time. Even simple thing like being a good observer. I have seen that this is what is, being seen as a trend in my practice. Or what if we did this happened. Sometimes even being imaginative, of course, with scientific, rigor and all that kept in mind, or having a skeptical attitude. When we read the scientific findings, go through the journal articles or attend presentations, so be a always questioning mind. Please remember, it's very important that we start with a good research question, because how good a research is defined by the question that we ask. A good or poor research question can make or break your research. So that's very important. Please remember, the question should be well understood and the problem should be well defined. Now, let me again reiterate and clarify this. The question should be well understood, not the answer. So if I understand the question well, I can have an elaborate way to answer that question, and I will go to length to look into the problem which exists and identify, do a literature review, and then go about doing it. So problem should be well defined and it should be well understood, especially by the researcher or the team of researchers or investigators. Now coming to the research question, what is it? It's something which is used to analyze and investigate a topic. It's usually written as a question and it's inquisitive in nature. You're curious, you're asking something so that it can be answered. And there are certain things which we have to keep in mind. A properly written question should be clear and concise at the same time. It should contain the topic being studied, that is the purpose of the topic or the question, and also the variables. Now, just to tell you, variables are nothing but something which is a characteristic or characteristics which vary from person to person. Just to give you an example, a quick example, it could be the experience of a person, it could be the age, it could be certain measurements like blood pressure measurement, it could be anything which varies from a person to another. So that's a variable. And of course the population. So a good written question, a properly written question will be clear, concise, and it will contain the topic being studied. That is the purpose of it. The variables, if possible, not all the variables, mind you, and the population being studied. Now, usually there are different types of questions, but we usually classify them as three main types. One is causal questions. The next is descriptive questions. And the third being comparative questions. Let's see some examples to understand this better. And then we will go on to the structure of the question itself. So coming to the causal questions. Now these compare two or more phenomena to determine if there is a relationship between one and the other. Let's see an example. Now obviously this is a relationship type. So for example, I say, does the amount of calcium in the diet of elementary school children affect the number of cavities they have per year? So if you see, I'm trying to relate the amount of calcium in the diet of the children with the effect on the number of cavities. So this is one phenomenon with the other. So you're trying to look at whether that intake of dietary calcium and the number of cavities is related, and that's a causal. So if you find an answer to this, you can answer whether this will be a causal thing or not, and how this relationship exists, and you will be able to, based on that, come out with the recommendations. Coming to the descriptive questions. Now usually this is something which tries to answer the question how much, how often, or what is the change that takes place. Just to see an example, how often do college-aged students use Twitter or any other social media for that matter? So this is again, you're trying to answer, or how much of it is a problem that people with tuberculosis do not seek quick care. So that's something again, how much? So that's a descriptive question. Coming to the third category, it's a comparative. Difference between two or more groups in relation to one or more variables. Now see an example again. So we will usually have what is the difference in. So something like that will be the stem of the question. So what is the difference in caloric intake of high school girls and boys? So we are trying to see if there is a difference, and if so, what is the difference? And that's something which we can even specify further. So that's something which we are going to see as a comparative question. So let's move on. Now, when we start looking at a question and identifying a question, so first let's start with a broad topic. So you start with a broad area or a broad topic of your interest, or the interest of the investigator group, or maybe if it's a resident or a postgraduate, it has to be the resident and the guide. So they have to define the topic and come up with a broad area. Now, once that is done, you need not start at that moment with a research question. You need not necessarily start, let me say, but you start with the topic. Now, once you have that, you start asking questions in that particular topic or the sphere of your domain, and then you shortlist. You may start with multiple and then shortlist and reach the final one. So it's much easier to start with the topic, and then search when your research topic is clearly defined. Even if you've not defined the exact focus, that's okay. So spend some time becoming familiar by reading up in that area, so that you have an idea what's going on, or what could be a lacunae, or what could be some kind of a gap that you can address, and which is of course possible within your time budget and the resources available. So that's something which you should do. Now the research question will determine how you go about doing your review and the types of studies that you include. We will have a section on review of literature in the following sessions, so we will go into that. We will not touch that much today. Now, one way to develop your research question is to put your topic into a format of a question to be answered. Now, let's take for today's discussion now this particular idea. What strategies can healthcare workers use to communicate effectively with patients having a hearing disability? Let me repeat. What strategies can healthcare workers use to communicate effectively with patients having a hearing disability? So this is a sample research question I'm taking. Now let's go forward. When you start thinking of a research question, please keep these things in mind. Is it interesting? To whom? To you. And if you're a resident, to your guide. Or if it's a team, so the team. So it should be interesting, because obviously if it's not interesting, I will not put my heart and soul into it. I will not really be interested in doing it well. So it's important that it's interesting to the people who are conducting it. Is it relevant? To whom? To the fraternity, to the community at large, or to the target population which you will finally come out with the results which it will imply? Is it feasible? Are you able to do it? Do you need a particular sophisticated equipment? Do you have the budget to do this? Do you have the manpower? Do you have the time? So all these things are part of feasibility. Is progress possible? If I take up something and I realize that I'm stumbling because I do not get enough patience, or example, like you find a very something very say rare thing, and you're very interested, but within the next 2 years or say 3 years, you will not find enough patience. You may not be able to progress. So that's again important. It may be a part of feasibility, but you have to think of progress. Do you have access to data? Now I think of something, but I do not have data. Now that data is available with certain other agencies, or maybe only with some specialized hospital. I do not have access, or within my hospital it's with another department which will not part with the data. I cannot do that. Is literature available? Now this is something which I always mention it with caution. Now literature availability is not the only criteria that you should be too much worried about. Why? Because sometimes when it's novel or new thing, you may not have too much literature, and that's where you are contributing to the literature. But please remember, if it's something which is related to some other things, like for example now coronavirus, but you have a family of coronavirus and certain other things, so you may have some related literature available, or certain other things, say for example for mask and other things, or for example hydroxychloroquine. So you may have those literature, and you may not have literature directly available for something related to what you are looking at. So it's possible. Is it within your resources? Is it going to be beneficial to others? So all these things should be thought of when you select a research question. Or simply put, please remember FINER. FINER stands for fine. FINER is a mnemonic. F is for feasible, that is feasibility. Is it interesting? I. Novel means new. Now many times you might think, how can I every time have something new? Every day thousands of papers are being published across the globe. So there could be a novelty. Novelty could be in a way you're doing it. It could be in a different population. It could be in the way you have phrased your question. If it could be also in something which you are trying to do in a different setup. So all that can be novelty. It should be ethical, and it should be relevant. So FINER. Please remember another thing which especially the clinician friends would appreciate, the PICOT or the PICOT framework, PICOT. Now this is a very useful framework which helps to formulate a research question that is answerable in the literature. So what is this PICOT? It's actually a framework which we will go into in the next set of slides. So it helps us to give us clarity about the different elements within the question, how they relate to each other, and what is the information needed in order to answer the question. So let's look at this. Basically, it stands for P is for patients or participants or population. So who are your participants or who are your patients or what is the population that you're looking at? What is the intervention or what is the indicator? So that's I. C is comparison group or a control group. And sometimes you may not have a comparison or control. So that's okay. What is the outcome you're looking for? And what is your time budget? When it started off, actually, it was only PICO. The time component was added later because it has to have a time frame, especially when you're going into a research. So PICOT or PICOT. So patients or participants or population, intervention or indicator, comparison or control, outcome, and the time. Let's look at this, how we frame it. So once you have identified the PICOT elements, try putting it into a sentence like this. In P, that is participants or patients of population, does intervention or this indicator compared to another control or result in a particular outcome within this time? So this is my framework, a broad framework. Let's look at the example that we started with, that is the healthcare workers communicating with clients with hearing disability. So if we look at that example, I put that in that format. Now here we don't have a comparator. That's okay. Now I can put a time frame, say next 6 months or 1 year or whatever. So in healthcare workers, so that's my participants. What communication strategies? So communication strategies is my intervention, and I can try out different. Result in more effective communication. That's my outcome. I want more effective communication. And again, based on that, I can decide what is effective. So I can have a baseline or something and I can define criteria. So more effective communication with clients with a hearing disability. So that's again, so this is the format. I hope it's clear. So let's move on. Now let's look at some other ways of wording a research question. We can word it in different ways. And please remember, as I told you, a research question is always inquisitive. It's always put in the format of a question. So what is the relationship between something and the other? Or what factors affect something, an outcome? How do the effects of something influence something else? How does one thing relate to another? Or why is something an issue in relation to another? Or if I observe something, so does this mean that that would happen? So all these are examples for you to probably look at. Maybe you can put up your own things, so you will come up with a research question. So that's something about research question. Let's look at some samples and thinking of the present situation. How effective is hydroxychloroquine in the treatment of coronavirus infection? Now, participants can share their thoughts. What do you think of this research question? Is this a good research question? Is it good for you? Any thoughts?
Yes. Bad. Somebody saying yes. No, bad. Yes.
So somebody who said bad, why is it
A lot
bad?
of them are saying yes. Population is not
I do understand that people have said yes, but
it's a potential question as there is no comparison.
okay, so no comparison.
Broad question.
Broad question, yes.
Population to be defined.
Okay.
Variables not defined.
Variables not defined, good.
Population to be defined. Comorbidities. Strain is not identified yet. Age is not identified.
Okay.
Population not defined. Okay, so a lot of reasons why.
Good. So
Yeah.
as you rightly said, somebody said this also, it's too broad or vague. So how effective is hydroxychloroquine in the treatment of coronavirus infection? Is too broad or vague. Now what about this? The next one. What impact would the shortage of hydroxychloroquine have on management of coronavirus cases? So what do the participants think?
Okay, not a good research
Not
question.
a good.
No proven study. First, we have to prove that it is effective. Okay, bad, not good. Question is skewed. All right.
Okay.
Population depends on effect of HCQ. No evidence. Okay, not much effect.
So do you
Okay.
think that this is a very good question and answerable?
Somebody
Yes, it
has
is
asked.
answerable.
Somebody
Yes,
has
yes.
asked, how are you going to measure the impact?
Okay, good. That can be defined, yes. But that's good that you're thinking. So if you see again, this is too narrow or focused, right? This is too narrow or focused. Let's see at another one. Of course, I've created this hypothetical. It's not that, just for the sake of understanding and discussion. So will hydroxychloroquine administration among patients that seem to be resistant or not responding to symptomatic treatment help in faster recovery of symptoms in coronavirus infection? Do you think this is better spelled out and this can be done better?
That's a better question. Yes. Again, somebody says no. Better
Okay.
question, better, better.
So when we discuss these are the three examples. Of the three, do you think this is the better or the best choice?
It can be simplified.
Of course, it can be simplified.
Too assumptive.
Yes.
Okay, but better.
I see a,
Maybe
as of now, we will take only the chat questions. We will have a, later. So participants are raising hands, I understand, but we will not go into the, yeah, we will take towards the end. Yeah.
Animesh, I think you need to go back because somebody has not understood. Somebody has posted that I'm too confused.
Okay, to go back to where?
Uh, uh, Describing the sample research questions.
This
Yeah.
slide or the other?
Yeah, the
before?
same slide. Yeah.
Okay, so how effective? This is too broad because how effective, what do I mean? And then is it in the treatment of, so it's, what do I mean by that? So it's too broad or too vague. Effective against what? What exactly I'm looking at? So I've not defined. Whereas when I go for this, so impact with the shortage of, again, it becomes too, too narrow or very focused that I'm talking only of shortage. And again, it's not, it can be like, it's not very well defined. Whereas if I look at this, I'm talking about patients that seem to be resistant or not responding. So that's again, I've defined. I've also talked about HCQ administration. And I'm also saying that, faster recovery of symptoms. And I'm talking about a particular category of patients. I'm also looking at, outcome. I'm also looking at what am I doing. So I have defined my intervention. I've said who are my patients or participants. I have said what am I looking at as an outcome. So you see, this is better. Again, this is among the three. If I look at, this is definitely a best choice among the three. It can be definitely further refined, but just to give you an idea and context, so it's taking the same kind of theme and I'm building on that. And of course this can be further defined and this can be narrowed down, so and subject experts can be taken on board. So that's something which you want to understand. Let's move on to another thing, hypothesis. Now this is a statement regarding the outcome related to an intervention. So distinct from a particular research question, a hypothesis is you're trying to give an association between a factor and outcome. It's usually predictive in nature. So if this happens, that will happen. Typically used when significant knowledge already exists on the subject, which allows a prediction to be made. Or sometimes you will also have another hypothesis, alternate hypothesis. Usually written as a statement as distinct from a research question where you're. Now, hypothesis need not always be there, but usually it's preferred, and many a times you will have a format from certain, say if you're looking at a university format, now it may be there. And if you especially look at nursing research, they always have a hypothesis. So you need not always have, if you have a research question and objectives well worded, and if you're wherever you're doing it or the grant agency or maybe your university approves, that's fine. But certain times you may require it. And that's why I have 2 slides on this, so just you have an idea. And it should always be developed before you start your data collection. Now, it's usually used in a quantitative research, but not usually in qualitative research. A complete hypothesis would usually include the variables, the population, and the predicted relationship between the variables. Now, let's give you some examples, and I'll not go into too much details of it, but if you look at this, a hypothesis, the first one, a company wellness program will decrease the number of sick days claimed by the employees. Now, I'm saying that if I introduce a wellness program in a company, that will lead to less number of sick days or sick leaves claimed by employees. That's a hypothesis. Now, whether this will happen or not, I obviously need to introduce this and then have a comparison and then decide based on my observation and results and analysis. Similarly, the second one, consuming vitamin C supplements will reduce the incidence of the common cold in teenagers. I'm hypothesizing. I do not know whether that will happen or not. And when I test this hypothesis by doing my study, I will be able to answer this. And then I either take that hypothesis, so that is, I accept it or I reject it. And that's something which I have to do by doing a research. So that's about hypothesis. A quick word on SMART objectives. You must have heard of SMART. So SMART stands for specific, S is for specific, M is for measurable, A is for achievable. So when I write an objective, it should be very specific. It should be focused. It should be measurable. I should be able to clearly say how will I measure and whether it is attained or not. It should be achievable, again feasibility, and it should be relevant, and it has to be time bound. So that's the concept of SMART objectives. So when I do that, when I write objectives, now these objectives, where do these come from? They will come from my research question and my hypothesis. So based on my research question, I will have a set of objectives. Now, one caution I would like to give, please do not have too many objectives. When you have limited number. I can have 10 objectives, but the issue with that is if I have, say, say a set of manpower, or maybe resource constraint or time budget constraint, then I may not be able to answer all of them. And please remember, when I spell out objective, it's a must that at the end of my research, I should be able to answer all my objectives that I spelled out. So if I have only the specific objectives in mind and a few of them, I'll be able to better focus and then answer. Again, the contrary is not true. That means if I have only 4 objectives and I answer more than that, that's okay, but not the other way. I hope I have made it clear. Now I would like to move on to the next segment, that is on the protocol writing, because we have little less time remaining. So we will like to, within next about 20 minutes or so, we would cover the protocol writing. So to sum up, how to write a good research question: find an issue or a problem that interests you, decide what you want to know about the specific issue in that, turn it into a specific question or a query, ensure that your question is answerable, check to see your research question is not too broad or too narrow. Sorry about that typo, not too narrow. So that's how you go about shortlisting and then going into a specific research question or developing a hypothesis. Now let's move on to the research protocol. So what is a protocol? Protocol is nothing but a detailed plan of the study. And every research should definitely have a protocol, and which should be written. So after proper and complete planning of the study, the plan should be written down. Why written? Why written? Because it's a requirement, and it also helps us to clarify our thoughts and think about all the aspects of the study. Because many a times our thoughts are abstract. Many a time when we put it down on the paper, we clarify our thoughts. Many a times we can share it with the others. It's also good if it's not a single investigator, but a team working on it, or if you have a multi-site thing, then a multi-site project or collaborative project with other sites involved, it's always good. Also, when you apply for ethics approval, you apply for funding, you require this. So it's very important to have a written protocol. So it will also help us to see whether we are on track. Now this is the general structure. So title page, introduction or a background, brief review of literature which is recent as well as relevant to the topic, the aim or objectives, the materials and methods, the timeline which is included in the methodology, and implications and justification of the study. Sometimes this may not be required as such, but it's always good to give implications, if not build it onto your introduction. Address the finance and the inherent ethical issues, if you can see them. And of course, the finance part will include the budget aspect of it, the references, and all the annexures which are in the form of any pro forma informed consent documents, which includes informed consent form and participant information sheet, any kind of permissions, any kind of formats and things like that. So let's look at each individual segments. So first thing is the title and the investigator. Now, when you have this first title page, please remember when you select your title, it should be short, but at the same time informative. Sounds like, this is contradictory, but yes, it's possible. So you have an informative title which gives information, but at the same time, it's not going into words too many or sentences. So keep it like that. I'll give you some, examples of that. What it should ideally do is convey the main objectives of your research, population, and if possible, the study design as well. So the person gets an idea. It's in context. Of course, it will also have the name of investigators, the guide, if at all, if it's a resident or a postgraduate. And then it will also have the affiliation of all these people, the institution name, university, etc. So all this has to be there in the first page. Of course, there could be some various guidelines which may vary slightly, but this is the crux of it. So this is what you will, and then you can always add version and date. It helps because what happens is when you submit it for research ethics approval, so you can always date it and then you can always modify it, and the different versions can be. So you will also have it in your backups as well, and it's always easier for you to not get confused. Let's look at this title. Prevalence of diabetic, of course, these are published paper, prevalence of diabetic retinopathy in the United Arab Emirates, a cross-sectional survey. Does this give you an idea about what is being done? Yes, of course. It's a quantification of problem of diabetic retinopathy. Where? In UAE. And what type of study? It's a cross-sectional survey. So that's something which is there. Identifying types of domestic violence and its associated risk factors in a pregnant population in common hospitals, Iran Republic. Again, if you see, it gives you very specifically what is being studied. Who are the people? So pregnant population in common hospitals, Iran Republic. So again, it gives you an idea. This is one of our papers, manifestation of malaria in Mangaluru, southern India. It is a little, you can say very focused, but again, it gives you an idea that it's manifestation of malaria in a particular place, and that's what is the paper about. If you look at this, it's quite explicitly stated and gives you a very good idea. So role of adult asthma education in improving asthma control and reducing emergency room utilization and hospital admissions in an inner city hospital. Of course, it does not give you where exactly, but then it gives you that it's an inner city hospital. Maybe a place specified would have made it even better. But you see, it's talking about role of a particular asthma education in improving control as well as reducing the hospital admissions as well as ER utilization. Association between obesity and high blood pressure among Lithuanian adolescents, a cross-sectional study. So you see population is there, type of study is there, and it also tells you about that this is telling you about obesity and its association with high blood pressure. Effect of vestibular stimulation on spatial and verbal memory in college students. So again, this tells you about effect of a particular intervention on something else among college students where it's not given, but again, this gives you the population. Effects of multi-drug resistant tuberculosis treatment on patients' health-related quality of life results from a follow-up study. So it tells you that it's a follow-up study and it gives you the effect of MDR TB treatment on patients' health-related quality of life. So that's the outcome you're looking at. And the last one, exploring the use of a Facebook page in anatomy education. Now, please remember that this is the title. The title does not give you the idea of objectives, whether they did what they did. So that's something which was like, if you look at one of the sentences in between, you will be able to see that they tried to look at, if this can be a supplement anatomy education beyond the traditional classroom. So coming to the next segment, that is background or introduction. So background or introduction will provide a logical and scientific justification to the study that you're proposing. It should also document the knowledge which is currently available regarding the problem. Now, many a times what is seen is, and especially with novices and residents and postgraduates, they start with, talking about too much about that particular disease or the problem. For example, if I start with, say diabetic retinopathy or maybe pulmonary tuberculosis, I'll start with talking about pulmonary tuberculosis or diabetic retinopathy and give a lot of details about it and all that. That's not required. If I'm talking about, say pulmonary tuberculosis and its aspect of delay in treatment, let me start with that particular aspect. And I say, why is that important that, delay should not be there? And what could be the result of that? So that's the idea. And what is known about it? So that's something which I need to describe. Any gaps and controversies, which is already there, which is existing and which you have identified by reviewing the literature. So that has to be done. It should be brief. Now, when I say this, people ask me how brief. Is it 1 page, 1.5 page, half a page? See, I don't have any particular answer which is categorically given. But please remember, it should do justice. And again, if I say 1 page, it doesn't mean that I make the font size at 10 and then no spacing and then cram it. So at the same time, it doesn't mean that, I have to stretch it to 1.5 page because Dr. Animesh Jain said that. It doesn't mean like that. So it should be doing justice. Now, if you have a topic which is quite vast, you will obviously have to condense it and make it, it can be 4 or 5 pages as well, but that's okay. And you will know because, you are the master of your subject and your colleagues and the mentors will know it. But please remember, it should be able to justify the conduct of your study. And that's what you need to do by doing an introduction. So in short, your study background or introduction should answer what is put in red on your screen. Why this study? If I can answer that, that should be doing justice to my introduction. Coming to the aim and objectives. Now, aim refers to overall goal. Many a times we will have a broad goal and then we break it down to smaller steps or objectives. So objectives are nothing but further measurable goals that need to be achieved to fulfill the aim which I have overall stated. So objectives will be further things. Now let me, tell you that sometimes you may not have aim, you may have only 3 or 4 objectives, 5 objectives. That's all right. That need not be the case always that you have to have an aim. But you may have aim, and in that case, you always will break it down to objectives. You may also have a primary objective and a secondary objective. Now, what is this? Primary objective is something which I'm looking at as a major thing. And at the same time, I may have secondary objectives. That means at the same time, when I achieve that, there will be other things which also will be getting fulfilled. So those are my secondary objective. I will try to give you an example. So if I say that if I'm trying to look at the cost effectiveness of a particular new drug in the treatment of malaria, that's my primary objective. But at the same time, I will try to look at how people are being treated. What are the different treatments being given? I'm also comparing maybe, also looking at say one kind of a facility that is private and a public facility. So that could be my secondary objective. So all these are possible. Please remember, as I've already told you earlier, it should be achievable within the time available at hand. These objectives should always be simple, clear, unambiguous, specific, and measurable. Or please remember, SMART, that is specific, measurable, achievable, realistic, and time-bound. Please try to keep your objectives limited for the reasons that I've already spelled out. And they have to be definitely be answered at the end of the study. So in short, if I can answer this red thing, that is what is going to be studied or done in this study, that is nothing but my aim or objectives. So that's the crux of it. Coming to the materials and methods, and in this, I will list out all the subheadings which are available. Sometimes some of them may not apply, but just for the sake of completion and so that you do not miss out anything, I will list out everything so that you have an idea. So, study setting. Study setting is, where is the study being conducted? Now, if I'm looking at hospital inpatients, so my hospital and my inpatient wards will be my setting. If I'm looking at patients in the OPD, that's my setting. If I'm going out to a community, that's my setting. If I go to the school children or an orphanage, that's my setting. So orphanage is my setting or schools are my setting. If I'm going to a particular jail, that's my setting. So depending on where I'm doing my study, that's my setting. Okay. Study design. There are different types of study designs which are there. So depending on what I'm using, I have to specify that. Again, we have a session, a segment on study designs, I think third session in the series, so that you will get more clarity. What is the study population I'm looking at? Now, please remember the study population is the entire population. So if I'm looking at school children, that's my population, but I may not be taking all the school children. Or if I say inpatients, I may not include all the inpatients in my hospital, but inpatients. Or if I say again, inpatients of a particular disease. So if I say diabetic inpatients, now that doesn't mean that I've included all the diabetic inpatients. I'll take a sample out of it. But my study population is that. Or if I say diabetic patients, so diabetic, why? Because ultimately when I come out with my conclusion, the results and recommendation, the results will again get applied to all the study population, and that's why I need to have the study population in mind. Then what is my sample size? As I said, I may not be able to take all the people because it may not be feasible for various reasons. So I take a sample, and when I take a sample, again, it should be representative. Again, we have a separate segment with study design and sample size and sampling methods. We will be dealing with that in detail, so you'll get more clarity. But for this moment, let's understand that I need to specify a sample size and the sampling method that I will employ in my study, and that has to be spelled out. And that should be in line with my research question and what I'm looking at as the outcome. So it should go in sync with that. Again, inclusion and exclusion criteria have to be spelled out. So if I say that diabetic patients, again, diabetic patients can be, many and different types. So should they be having complications? If so, what complications? Or if I'm excluding them, what complications? Or if they are diabetic for 1 year, 2 years, 5 years or beyond. So that's again my inclusion or exclusion. But here I want to share with some experience. I have realized many a times what happens is just because this is there, people put up a criteria. They say, okay, my inclusion is diabetic patients with, say, diabetic of 5 years or more, diabetes of 5 years or more. So exclusion doesn't become diabetes patients with diabetes of less than 5 years, because you cannot have something which you have inclusion and the opposite of that as exclusion. And that many times happens because we don't find out. So in that exclusion, you need to say specifically what are you excluding and which particular reason. If you have in mind, you can spell that out. So I can say that diabetics with some comorbid conditions, or specify, say, diabetic with, say, hypertension or maybe heart conditions, whatever. So I need to specify that. I don't say that if I say children, I don't say that adults or say elderly are my exclusion. I hope I've given you idea. So many a times this is what happens. So inclusion and opposite of that will be exclusion. It's not like that. You need to specify exclusion depending on what you're looking at. Then the study period, right from your study start to the end. That's your study duration or study period. Then the variables. And as we looked at, variables are characteristics which vary from one person to another. And then what are the outcomes I'm looking at? Am I looking at something being reduced? Or am I looking at the vision being improved? Or am I looking at hearing being improved by doing some particular procedure? And what is my unit of measurement? What are the classifications or definitions that I'm using? If I'm using some definition which has multiple types, I need to specify what I am following. Like, for example, hypertension or asthma, bronchial asthma. There are different classifications. On which way? If I'm looking at clinical criteria, I need to specify. And then what is my reference? What is my data collection procedure? How am I going to collect my data? So that's again important. And I need to specify that. So I will start with, after getting due permissions and the approval from the ethics committee, so and so like will be approached, or all the patients will be like, if I'm doing in a group, so they'll be briefed about this, or I'll be enrolling such patients. They will be further briefed about the procedures. They will be given information in the language they understand. and then there will be informed consent which will be taken, then they will be made to go into a particular place, and then these procedures will be done, or their data will be recorded, these tests will be done. All that has to be specified. Or if I'm collecting some data with multiple procedures as well as asking them questions, so interview will be done based on this interview schedule that I have developed, and then the data will be collected, the reports which come of the tests will be tabulated, and then so all that has to be specified in my data collection procedure. How am I going to handle the data and analyze that data? So that also has to be spelled out in the beginning, and you need to at least specify what you will be doing. Again, we have a segment for data analysis, the basics of the statistics, so that will be dealt by Dr. Praveen again, so that you will get an idea about it. Very importantly, institutional ethics committee approval, because every research has to be ethical, if you remember, even in the final criteria. So you need to look at that. Overall, in this segment of methodology or materials and methods, I need to answer the question, how to conduct the study. And if I answer that clearly, that is nothing but materials and methods. Ethical considerations, please look into things like, if there are privacy and confidentiality issues and things like informed consent, how do you obtain any kind of, breach of confidentiality could be, or how do you protect the data and all that, you need to specify, and even look at principles of respect, beneficence, and justice. We will deal about this in another segment of this research series, webinar series. So I'll not again go into details of that. And then write your references in a correct manner. So use a particular format. There are different styles: Vancouver style, Harvard style, APA style, and Chicago. The usual standard that we use is the Vancouver style. In some journals, they ask for Harvard, but general usual standard for every kind of protocols is Vancouver style. If it's not specified, check with your wherever like you're sending it, and then find out which one. If not, the usual standard, as I said, is usually Vancouver style. But please remember, whatever you're using, follow one style. If you're using Harvard, use Harvard. Do not mix, because sometimes that happens. Usual standard is a Vancouver style. Again, we will have a segment on reference writing and how to search literature, so we will deal more with that. Many a times people confuse between reference and bibliography. Just to clarify, reference is when I write and cite. So I write it with a superscript and I keep citing it. So that means there is a citation involved as I write in the text, and I give a reference to that. Whereas bibliography need not always be cited. Let me give you a better understanding. Now, for example, when I was preparing for this webinar, I have looked at lots of things, lots of resources, lots of books, journal articles, some of the websites, other things, experience, some of the thesis. Now, when I did that, all that I have gathered from that is the knowledge I've gained. Now, all that I have not probably used here. So if I have to write a reference, I will cite certain things which I'm using, and that's my reference. But when I write bibliography, there are certain things which I did not use, but I gained knowledge about. So that will be my bibliography. To give you another concrete example, coming back to my tuberculosis example, I may read about tuberculosis to just gain knowledge. What is the causative agent? What was the history and other things? I may not use that. So when I write bibliography, I will I will list out all those. But when I write references, I will not include things like history where I have read from, or maybe the discovery of the bacteria and how it was identified and things like that. So I will not cite that. So the reference will not have that. So in other words, I can say, loosely speaking, that bibliography contains reference, but not vice versa. The appendices will include your questionnaire or instrument or any kind of pro forma that you will have, data extraction sheets, informed consent documents, including the participant information sheet and the informed consent form, any kind of letters of approval, any kind of tools that you will use, any kind of definitions, all that. So that's your appendices. To sum up, we have looked at the format of our research protocol. We've also looked at the research question, and we've looked at what are the nitty-gritties, how we define a good research question. And we've looked at some of the examples, how we define it. And then we have looked at the different segments of a protocol, starting right from the title page, the investigators, and then of course, we looked at the aim and objectives, then the review of literature a bit, and then the methodology aspect of it, and then we looked at the references. So that's about this. Now let's take some questions, but please remember, research is very important, and any good research starts with a good research question. So a good research will always have a good research questions to start with. A return protocol is a must for starting a research, and carefully considering and investing time could go a long way in doing a meaningful research. Everybody has a role. You have a role to play. I have a role to play. We all can make a difference. We all can make a difference in doing a good research. Now we can open it for questioning, and this is only selected bibliography because I did not have too much of space, so I thought I'll just put some. So let's take some questions. We have some time for questions.
So before you get to questions, I just wanted to make some announcements.
Yes, Dr. Harsha.
Just wanted to announce about the second part, which is on 14th May, 8 p.m.
Right.
So our webinars will be on Monday and Thursday. Just wanted to inform all the participants. And I would like to share the, this is the, these are the 8 topics we will be dealing in the next few sessions. So just anybody who is interested, they can take a screenshot of it. Okay, sir. I think I'm done. We can take questions, sir.
Yes, we can take the questions. Yeah.
How do we analyze when we have to put on references and when bibliography? This is from Dr. Raksha Rajesh. Hello, Dr. Animesh, sir. I hope you are. You can unmute yourself, no?
Yeah, that depends on. Basically, see, many times there will be formats given. Sometimes some of the particular branches I have seen that they prefer bibliography. Usually we use reference. So I just mentioned because many times people confuse. So that's why I mentioned it. But otherwise, usually you go with references. Bibliography is not really always wanted. But many times, if you would have seen that PhD thesis or many times nursing research and all, many times they use bibliography as well. So just to give you an idea, what is the difference? Because people don't always understand the difference, and that's why I brought this up.
How many objectives are needed for PhD?
Again, it depends on. I think there's a question that how many objectives are required for a PhD research. Now, again, that depends on the topic that you have taken. As I said, it's not really necessary that you will have only 3 or 4 or whatever. It's actually dependent on my research and the time and of course the depth of the question. And so you will have to go for the objectives based on that. And of course, it has to be also decided by consensus between you and your guide and the investigation team.
See, objectives are written based on the problem you are trying to address. So if you have a broader problem, you will obviously end up having more objectives. If you have a narrower problem,
does every study need to have ethical committee clearance? What about some retrospective study on available data where confidentiality is not breached? Yeah.
So if it's a study which say retrospective study, but even then it is required because retrospective study means you're talking about, I believe that you're talking about hospital data. Now, if it's a hospital data, so again, I might be thinking of hospital data which is there, and then again it's a patient's data. So I may have to go for I will have to go for an ethics committee approval. And as an investigator or a researcher, I don't decide that it does not require ethics committee approval. It has to be decided by the ethics committee. One. Second thing, again, the ethics committee will insist that that should be anonymized. You should not have identifier for those patients or participants. So that needs to be delinked. So all those things have to be followed. We will have another session actually on research ethics. So we will clarify these things further. But as of now, I think this should suffice.
Is a cross-functional interdepartmental research? Is a cross-functional or interdepartmental research a good idea in India?
Yes, of course. I think interdepartment and inter-institutional as well as in, collaborative research, as I gave you an example, it actually helps, and it's coming in a big way now. And I think we have to start moving into that kind of a era where we are collaborating, because it becomes much easier. Even within interdepartmental researches, when you see, like, say, for example, pathology with radiology and say orthopedics or surgery. So you have multidisciplinary, or sometimes like we are trying of something in different spheres. We are also starting something as basic sciences collaborating with clinical sciences and paraclinical sciences. So a lot of those things can be actually done, and they can answer the questions comprehensively. The other thing is, it also helps later in say coming out with conclusions comprehensively, because the interpretation is much better. Third thing which also it helps in is the publication aspect, because many a times clinicians feel that they do not have one sometimes expertise, with no offense meant to anybody. The other thing, the time. So pre and paraclinicals people could also help in that. Now, Dr. Sriharsha, we have some raised hands. Do we unmute them or we take questions from?
Animesh, there is a question. How could you apply PICOT for an in vitro study?
In vitro study. That's usually for a clinical treatment aspect kind of a thing, as I understand. It's only for that. It's not for, there must be a different framework for that. I'll just try to look at that, but it's not for that. Praveen,
So
anything that you want to add?
For the in vitro study, we have to use the EBM framework. We have not.
Yeah.
Yeah, actually, I totally agree with you, because PICOT is basically for the clinical research and epidemiological research. We may take few components of PICOT, like for example, problem and outcome, like PO combinations. When we are using the in vitro studies, it all depends on what is the objective of the study and what is the aim of the study. But by and large, we are not going to use PICOT for the in vitro studies.
Thank you.
Sir, myself Vignesh. The
Yes.
session was really good and informative. So
Thank you
my
so
doubt
much.
is about, for example, what if the research problem doesn't contain much literature available on the website or somewhere, but it's really helpful for the society and for like pharma industry, which is also new also. So what if there is no literature contains in the website or somewhere? So what is the solution?
So very good question, Dr. Vignesh. Basically, see, as I said, if we were always to look at the available literature, we will not do something new. I've already mentioned that, but just to clarify that again. So if you are convinced, and see, sometimes, especially if you're saying pharma industry, and I believe that you're talking about newer advances in treatments and things like that. So, or maybe vaccine research. So what happens is you will have some kind of baseline data and maybe, in vitro studies. So you will have something like that and to back up, or maybe you will have say similar molecule or something which, so you will have some efficacy already generated and you will have some empirical data to say that this can work. And that's where you're going. Because even say, for example, pharma industry will not really invest or go into R&D until and unless you've already had some kind of promising results shown. So that is something. The other thing is, don't always bother about having too much of references always, because it's not going to be possible, not just for the pharma industry, but even other researchers. Like, for example, as I gave an example, ongoing pandemic coronaviruses crisis. So basically, again, if I look at that, somebody has to start and then document. If you look at the history, epidemiological history, we did not have too much time, but if you look at the epidemiology history, many of the things like, which were found out, including things like smoking and lung cancer, or say phocomelia because thalidomide. So all these have happened because, somebody was observant and actually looked at that and then documented it. And then it went on, and then that's something which I hope I have been able to answer that.
There is a question on qualitative research. So, what type of?
So Praveen is the best person to answer it. Qualitative.
We have not included a session on qualitative research in this.
No, but if something, Praveen,
if
if you can answer
keen,
quickly,
if
yeah.
somebody is keen, then we can add a session. We can tell Sriharsha and add the session.
Maybe after the series that is, or let's see, yeah. But Praveen is a good person to answer that because he does conduct, and I have attended his qualitative 1 or 2 sessions as well.
Yeah, there's a question. Could you explain that what type of questions required for qualitative research? So qualitative research is basically to identify what are the factors that are responsible. For example, it is going to answer why, how, in-depth kind of an information. In these qualitative research, we are not going to have a hypothesis kind of a thing, and our objectives will also not be in the form of PICOT or SMART, anything of that kind. The question that we are going to ask is why this is happening. So for example, if the students are failing in exam, okay, so my qualitative research question is going to be why they are failing. It is going to be very broad, and we are not going to keep anything objective into it, any objective measurements into it. We want to keep it broad so that we can get thick amount of information. As Animesh sir told, I think if there is any demand for it, I think we can have it after the series gets over. We usually use a criteria called finer. Finer criteria is something called your qualitative research question should be feasible, interesting, novel, and relevant and ethical. So this is what is called as finer criteria. So finer criteria is used when we are usually setting the qualitative research question.
Any other questions which are?
There's a question. I think this. What is statistical hypothesis?
Oh, okay. So basically, it's a part of hypothesis testing. I think that's what is being referred to. So we usually will have a null hypothesis and an alternate hypothesis. And I think we will be covering this in basics of statistics. Praveen, I think you'll be doing that, right?
Yeah, I won't be doing much on the null and alternative hypothesis, but I'll introduce about it.
Introduce that. Yeah, exactly. That's
I'll introduce the concept.
Yes, that's why we have kept it very basics of, because it will not be totally possible for all the aspects, but we are trying to give you as much as possible within the time available and the sessions that we have planned for. Of course, I think we can see if we can further do something else, or maybe if required, we will try to help out people the other ways also.
Sir, may I add something related to the statistical hypothesis?
Yes, please. Yeah.
Yeah, a statistical hypothesis is an analytical question. Usually when you have two treatment options, you want to say one treatment option is better than other, or the one treatment option is not so good than the other. So this is what we call as a hypothesis. To make it more statistical, we will add some statistical terminologies to it. The difference in blood pressure measured is going to be, the blood pressure reduction is going to be more with treatment 1 compared to treatment 2. It means that you are bringing a hypothesis with a difference. Sometimes you want to put it as a relationship. The smoking is associated with development of lung cancer. Here you are adding a statistical terminology called association. Okay, so the hypothesis which you want to use for the test, which is expressed in statistical terms, is called as a statistical hypothesis. Okay, so we will discuss about this statistical hypothesis when we'll be talking about what are the tests of hypothesis, which test has to be used in which type of a data. I can explain it with the examples that time.
See, there is a question on how difficult it is to get an ethical clearance for a study involving innovation, that is a new surgical technique. There was that question there. See, there are three kinds of review which any research goes through. One is the scientific review, The next is the ethical review, and then the third one is the regulatory affairs review. Regulatory affairs is basically when you're sharing data with somebody else or there is money involved and all that. Ethical review is all about protection of participants. So if your surgical intervention ensures that your participants are well protected, then there should be no difficulty in getting the ethical clearance.
There are a lot of questions coming up on questionnaire and its validation. I think we'll be discussing about it. I think in session, there is a
Yes,
session.
I have written that already, that we have a session on questionnaire designing exclusively. So I think we will be able to clarify much more on that. And that will also deal with some, few other types of tools for data collection, but particularly about questionnaire designing and pro forma and interview schedule.
I think most of the questions are going to be addressed in the next future sessions. So I think today's sessions, we have answered most of the questions that were relating to today's sessions. So the questions on whether we need to prove the hypothesis right, and then there are so many other questions on ethical reviews, whether meta-analysis, what is the role for ethical review, questionnaire design, all that we'll be addressing in the subsequent sessions.
Okay. Yeah, I think if there's anything pertaining to today's session in particular, maybe if there is a burning question we can take. Otherwise, I think we are already 9:33 already. So
Yes, Dr. Shriyasha, shall we wind up for the day?
Yes, ma'am. I think we can.
Yes, ma'am.
Thank you, Dr. Vijaylakshmi ma'am and Dr. Animesh sir for an excellent and elaborative lecture on introduction to research topics. Today we'll wind up now. We'll be seeing you all on Thursday, which is May 14th at 8 o'clock.
and Dr. Sriharsha, the same link is valid for the next sessions also, right? For the participants who have registered?
The link and the meeting ID is the same for all the
Same, exactly. Because the meeting, when it comes as a confirmation, it comes for all the sessions. So participants can join with the same. So they can save that email and join. Right. Thank you so much, Dr. Sriharsha.
There are a lot of requests for the slides that we have just shown. We will share all the slides at the end of the series.
Not only that, there will be a recording available, as I understand Dr. Sriharsha has said that. So, right?
We'll work on it, sir.
Yes, sure. Thank you so much. Thank you.
Thank you very much.
Thank you all. Thank you.